We're going to talk about some ophthalmology cholinergic drugs, and more specifically, orthoptic cholinergic drugs. Let's first start off by getting us familiar with the diagram that I've created here. So that top part is going to be our nerve ending, and the bottom part is going to be the effector organ. First pathway we're going to talk about is the parasympathetic pathway or the cholinergic pathway. We have our acetylcholine in our presynaptic vessels. It's those little orange dots there. The acetylcholine gets put into the synaptic area, and when it gets released into the synaptic area, we have the acetylcholinesterase comes in and tries to digest the acetylcholine, and it makes its byproducts. But some of the acetylcholine gets by and it binds to the cholinergic receptors on the effector organ and makes the effector organ nice and happy. The first drug that we have is our direct-acting cholinergic drug. It's those little ovals there. And what that does is it interacts with the postsynaptic cholinergic receptors on the target organ, activating the organ in a similar fashion as the acetylcholine, which is why our effector organ is still smiling. There's a few different names for this drug. One is direct-acting cholinergic. We have parasympathetic agonist. We have parasympathomimetic. Try saying that one a few times. And then cholinergic. So it mimics acetylcholine, producing meiosis for the pupils. You get kind of a wet side effect with it. And then the drug that we use to do direct-acting cholinergic is the pilocarpine. The next drug that we have is indirect acting cholinergic. So that gets released into the synaptic cleft, and then the acetylcholinesterase comes in, tries to digest the acetylcholine, but the indirect acting drug comes in, binds to the acetylcholinesterase, and causes the acetylcholinesterase to spit out the acetylcholine. So now we have more acetylcholine in the cleft, making our effector organ nice and happy. So in summary, it prevents the enzymatic breakdown of acetylcholine. You get meiosis in the pupils, and then those are our drop examples, which the most noted is Tensilon, Prostigmine, and Menstanon. The last parasympathetic drug that we have is the anticholinergic drug. So we start off just like all the other ones with the acetylcholine in its presynaptic vessels. Gets released into the synaptic cleft. But as you can see here, there is no acetylcholinesterase. Instead, we have our anticholinesterase drug, and what that does is it interacts with our acetylcholine and actually blocks the cholinergic receptors, so the acetylcholine can no longer go in those receptors. Then it decreases the parasympathetic response in these organs. So in summary, we have four different names for this drug. We have anticholinergic, we have parasympathetic antagonists, we have parasympatholytic, and the antimuscarine. It blocks the receptor sites, so it prevents that acetylcholine from activating the effector organ. In response, you get a pupillary dilation and a cycloplegia response. And then our examples, most prominent, are those tropicamide, cyclophenolate, atropine, botulinum toxins, and things like that.